Good afternoon, everyone. My name is Nirav Shah. I'm the director of Maine's Center for Disease Control and Prevention. I'm delighted to be able to join everyone this afternoon to provide everyone with an update on the state of COVID-19 across the state of Maine for today, Tuesday, September 29th, 2020. We begin today's briefing on a sad note. Maine CDC has recorded the death of the 141st person with COVID-19 in Maine. She was a woman in her 80s from York County. Her passing comes on a day when worldwide 1 million people have died with COVID-19 across the globe. Indeed, in the US alone, over 200,000 people have died, and over 7 million people have been affected nationwide. Those numbers, 1 million around the globe and 200,000 in the United States alone, represent a terrible, unfathomable, wrenching set of numbers. Think about the impact of so many dead in such a short period of time. Think about the number of wives, husbands, daughters, sons, fathers, and mothers whose lives are now one person poorer. The number of people for whom the embrace of a loved one is more of a memory than a reality. On this solemn day, as we grieve the collective loss of all of these individuals and mark the passing of the 141st person in Maine, let's all pause to remember those who are no longer with us. Overall, across the state of Maine, there are now 5,337 cases of COVID-19. An increase of 37 cases since yesterday. Of those, 4,777 are confirmed cases, an increase of 22, and 560 are probable, representing an increase of 15. Cumulatively, 447 individuals have been hospitalized, and right now in the state, 8 are currently in the hospital. 5 of whom are in the intensive care unit, and 1 of whom is on a ventilator. That puts our overall hospitalization rate in Maine at less than 1 per 100,000 people. To put that number in perspective, the national rate of hospitalizations is 9 per 100,000 people. Overall in Maine, 4,627 individuals have recovered, an increase of 28 recoveries. And as I mentioned a moment ago, 141 individuals have passed away with COVID-19. Among our cases now are 1,056 healthcare workers, an increase of 6 healthcare workers since yesterday. I'd like to now provide an update on some of the principal outbreaks at which Maine CDC has been involved, starting with some open outbreaks. Let's start with some operations and cooperations we've had with Sanford High School. Right now at Sanford High School, there are a total of 18 cases associated with the high school. Maine CDC and the Maine Department of Health and Human Services have been working very closely with the superintendent and the leadership of the Sanford High School to stand up a testing site for individuals connected with the high school community. Just over the last few days, specifically on Friday and Saturday of last week, roughly 900 samples were collected and sent to the Maine CDC laboratory for testing. Of those 900 samples, all of which have been tested and reported out, there were an additional 3 cases of COVID-19 detected in and among Sanford High School community members. That brings, again, the total number of cases to 18 associated with the high school. In addition, we've also been working on an outbreak associated with Pinnacle Healthcare in Sanford, where there are a total of 9 cases of COVID-19. And finally, at the ND paper facility in Rumford, there are now a total of 23 cases. That facility recently completed another round of universal testing. And thankfully, during that round of universal testing, there were no additional positives reported. However, not all of the test results have been fully analyzed and validated. But based on what has been analyzed and validated from the 600 or 700 samples that were collected, there have been no new positives. I'd also like to announce 2 new outbreaks that Maine CDC has opened in the recent few days. The first is an outbreak investigation at the Massabesic Middle School in East Waterboro, where there are a total of 4 cases. Maine CDC is working very closely there with school officials to arrange for testing for COVID-19 of any student, staff member, or faculty member of that middle school who is determined to be a close contact. I'd also like to announce that we recently opened an outbreak investigation into the Little Lambs Learning Center in Springvale after detecting 11 cases. Now, one very important note here is that this facility, the Little Lambs Learning Center, voluntarily closed its doors in mid-September, and all staff and patients have been notified and were notified early on. We're continuing to work with that facility as they prepare to reopen their doors, having made sure that all staff, all parents, and all students or all other individuals who attend or work with that facility were notified and to have also been arranged to have the opportunity to be tested. I'd like to turn now to provide an update, a Maine-specific update on some national news that you may have heard about. At the national level, the U.S. federal government has been working very closely with Abbott Laboratories to secure, for the benefit of states, some additional testing options. Specifically, not too long ago, a new testing device manufactured and designed by Abbott was recently approved by the US FDA. This is a test that's called the Binax Now test. It utilizes a lightweight, almost credit card-like mechanism in order to conduct the testing itself. The test is flexible, it can be used in different settings, and uses a technology that is called antigen-based testing. You may have heard about antigen testing. Antigen testing differs in a little ways from the type of testing that's done, say, at the state laboratory up here in Augusta. That type of testing looks for the genetic material that characterizes the virus. Antigen testing, by contrast, looks to identify the spiky proteins that you may have seen pictures of that are on the surface of the virus itself. Maine will soon be receiving approximately 26,000 of these Binax Now tests as part of its initial allocation. We understand from the federal government that subsequent allocations will also be made to the state of Maine throughout the end of the year. We're not exactly sure when the first such shipment will be received, but we understand it could be as soon as within the coming week. As we receive more in terms of when those shipments will be received, exactly how many, and how we will be deploying them, we'll make sure to keep everybody updated. But the bottom line here is that the availability of at least 26,000 initial tests using this rapid testing platform represents a welcome addition to the types of tests that are already available in Maine. These particular tests have the benefit of returning a result within approximately 15 minutes, if not sooner. They can, as I mentioned, also be used in a variety of settings, given that the testing device itself is rather small and self-contained. All of these advancements mean that we will be able to continue offering greater and greater availability of testing options to as many individuals in Maine as we can. Speaking of testing, I'd like to provide everyone next an update on some of our metrics. First, in terms of positivity rate. Our 7-day weighted positivity rate in Maine now is 0.48%. To put that number in perspective, the national average for positivity rate now is 5%. That is to say, right now, Maine's positivity rate is about 10 times lower than the national average. In addition, our testing volume, that is to say, the number of tests that are being completed, is approximately 435.5 tests for COVID-19 per every 100,000 people in Maine. To put that number in perspective, the national volume of testing is approximately 272 tests per every 100,000. The rate in Maine is 435 per 100,000. So with that, I'd like to now turn things over to our colleagues in the media. And the first question today goes to...
Yeah, hi, Dr. Shah, thank you. I guess my first question would be about the new antigen testing machines. How does the state plan to either use or distribute those across the state? And will it be to private organizations or state governments or some mix of all of those?
Sure, Charlie. No final decisions have been made as to exactly who the initial recipients of these tests will be. That being said, the federal government and the US CDC have recommended that one of the principal use cases, as those scenarios are called, one of the principal use cases be in and among schools. In particular, to try to get a rapid sense of whether a child or a teacher or a staff member who becomes or exhibits symptoms that could be COVID-19 during the school day, to use those tests on individuals like that. Having that early look at what might be happening at the school level when someone starts exhibiting symptoms helps public health folks at my agency get a quicker sense of what we might be contending with. If that rapid result returns a positive, that takes us down one pathway. If it returns a negative result, that immediately takes us down a separate pathway. So that's one initial set of use cases that we are looking at. But we're also examining other similar types of applications where these rapid tests could, again, similarly help us set down one fork in the road versus another very quickly to help inform the immediate public health response. No final decisions have been made. We're having discussions right now because it takes more than just having the test to use the test. There also has to be a healthcare provider who can observe the operation and conduct of the test to make sure it's being done correctly, as just one example. So we're making sure we're shoring up our planning so that when the tests arrive in Maine, we can rapidly deploy them back out to where they're going to do the most good.
Great, thanks. And just one other question on that subject. I guess several weeks ago, or maybe even a couple months ago, when there was some news on antigen testing, you had said, I think that your guidance at that point was that those types of machines should be used to test people only when they start showing symptoms of COVID. Would that still be the approach that you would be advising with these machines going out now, or are you open to maybe more of a using antigen testing more liberally, even if people aren't showing symptoms?
It's a great question, Charlie. Our team of medical officers and epidemiologists has been discussing that exact issue. The data suggest that the test performs the best when it is used in individuals who have symptoms, specifically recent onset of symptoms. That being said, we've had a number of calls with our federal colleagues who have also advised that there could also be a role for these tests as more of a screening mechanism. That is to say, in individuals who do not have symptoms. The fact of the matter is, Charlie, that there are right now not great data on how accurate the test is in individuals who do not have symptoms. We are not ruling out the possibility of using it in that fashion because, among other things, the US CDC and federal government have recommended it. But what we have seen of the data suggests that the accuracy of the test and the test performance is best when it is done among symptomatic individuals. So I think in our rendering, Charlie, it's a question of first best use cases, second best use cases, third best, so on and so forth. And based on the data right now, the first best use case is among symptomatic folks. Maybe a teacher who starts feeling a little bit unwell during the day, something of that nature. As we get more data around the use in other situations, we'll be able to provide recipients of these tests with better data.
Thank you.
Mm-hmm. I'm going to turn next to Joe Waller at the Press Herald.
Yes, hi. Thanks for answering the questions today, as always. First question is about Sanford. When you say 900 have been tested or 900 samples, is that all or almost all of the students and staff or a portion of it? And then I have a follow-up.
Sure, Joe. We planned for a maximum of approximately 1,500. That includes all students, all faculty members, and all staff. We do not know, I do not know right now, and though I can try to find out, what fraction of those, say 600, had separately gone to their own healthcare provider or another swab and send site and separately got tested. So we're getting a handle on exactly what fraction of the total school community ultimately did get tested. We certainly recommended it. We amended the standing order to make sure it was accessible for everybody. But we also know that individuals may have separately visited their own healthcare provider or another swab and send site. We're trying to piece all that together right now.
All right, so before I get to my follow-up, just to make sure I understand, so you recommended one way or another that the entire Sanford High School students and staff get tested. Is that right?
That is correct. That is correct.
All right, my follow-up question is, I was wondering, when a county goes to yellow, York County, Oxford County so far, is it only schools and there's no repercussions for other types of, like your student in Oxford County, high school student can't do a cross-country match, but the parents can walk into the Oxford casino, for instance, just as one example. Is there any thought to having the yellow designation apply beyond schools?
It's a consideration, Joe, but one of the things I will note at the top is there's sort of an assumption in your question that the risk calculus should be the same for kids in schools as it would be for individuals visiting a retail establishment or an entertainment establishment. And I'm not sure if that's exactly right, Joe. We have learned more about schools and leveraged what we've learned from other countries. And we've got a finer sense of what the risk levels in schools are. We've got a better sense of the risk to older students versus younger students, things of that nature. So I'm not sure that there is a one-to-one matchup between the way we think about the risk in schools to students and from students versus the risk that we might see from other types of social and economic activities. Another element there, Joe, that is up for discussion as a potential differentiator is, just the centrality of schools and education, and whether we ought to be more careful as we think about schools and reentry and reopening than we might with other things. So that being said, all of that is a wind-up, Joe. We are thinking about ways to harmonize these metrics a little bit more, but I don't know that they will rise and fall together in every single instance. it's partly a risk to the participants themselves, but also a risk that allowing that gathering could precipitate or generate outbreaks elsewhere in the community. So I hear where you're coming from. I push back a bit because I don't know that the analysis is equivalent for all of those types of settings, schools versus non-schools. I'm going to turn next to Allison Ross at WMTW.
Hi, Dr. Shah. Thank you so much for taking my question. So going back to the report from the Department of Corrections about some of Maine jails not following the guidance that was put out by the Maine CDC, will there be any repercussions for these jails, and how can something like this be prevented in the future?
So as to questions around repercussions, I would refer those to my colleagues at the Maine Department of Corrections. They've got the principal relationship with jails, particularly around the issues that you note. But the second part of your question is a really important one, which is where do we go from here, particularly around prevention? Actually, just yesterday, some of my team members here at the Maine CDC joined with the Maine Department of Corrections and the Maine Sheriff's Association to have an in-depth meeting with them around putting some of these findings and recommendations into real practice. It was a really productive meeting. We made sure that my team and I were available to answer every single question that the sheriffs and the jail staff had around getting up to where they need to be. It was a really, really productive discussion. We focused on testing, retesting, infection control, PPE, and most importantly, something that I don't think we've focused enough on in these media briefings, which is social services as it relates to individuals in jails or in prisons. And we had a good discussion about how to get each of those items to where they need to be. I hope that as we've gone through those discussions now and equipped jails with everything they need, we'll be in a better stead from a prevention standpoint. I'm going to turn next to Steve Betts at the Courier-Gazette.
Yes. Hello, Dr. Shah. There was a case diagnosed at the Camden Rockport Middle School. So I guess my question is, has the CDC recommended that there be widespread testing in that school? And also, have there been any other cases diagnosed there since Saturday?
Steve, what I can tell you is that we have not opened an outbreak investigation into that particular school. And we generally don't comment on individual cases, but again, we have not opened an outbreak investigation at that particular school. What I will share as well is that we've developed a standard operating procedure that schools that lays out what they need to do in the event that they've detected a single case, 2 cases, or 3 or more cases, and who they need to contact, what they need to do, and what their playbook in order of operations is. That's what we've asked and worked with schools on to make sure they've got everything they need, both in terms of guidance as well as support from Maine CDC if they become aware of a case in their jurisdiction. At this time, we have not opened an outbreak investigation, but we continue to communicate with schools across the state as they happen to be made aware of cases.
So 3 or more is when it becomes an outbreak, is that correct?
That is not correct. It is at least 3 or more cases, but there are a number of other epidemiological factors that also have to be met before we open an outbreak investigation. So for example, it has to be 3 or more cases, but they have to be across different classrooms. It has to be at least 3 or more cases, but they have to be laboratory confirmed. There have to be 3 or more cases, but they can't be among individuals, say, of the same household. They have to represent wider epidemiological transmission. And they have to be 3 or more cases within a particular building, not across multiple buildings. If they're across multiple buildings, we think about it in different epidemiological terms.
Got it. Thank you.
You bet. I'm going to turn next to Evan Pop.
Hi, Dr. Shah. Thank you. Can you describe how the Maine CDC has worked with the Secretary of State's office to make it as safe as possible for people who decide to vote in person in the upcoming election?
Evan, I'll start by noting it hasn't been just the Maine CDC that has been involved in making sure that the run-up to Election Day and then Election Day itself is made as safe as possible. There have been a number of other groups, including the Department of Health and Human Services as a whole, as well as the governor's office and a number of other entities. Of course, the goal is to make sure that health concerns don't dissuade individuals from ultimately casting their ballot and providing options to do so. Maine CDC's role specifically has been to help provide health-based guidance on ways in which polling places, as one example, can be made as safe as possible. For those of you who have tuned into these briefings now, a lot of the guidance that we have provided to the Secretary of State's office will not come as a surprise. Things like installing plexiglass to reduce the likelihood of transmission between, say, those who are coming to vote and the workers who are there working at the polls. Asking polling places to ensure that every single person is maintaining physical distance, and strongly recommending the wearing of masks while individuals are at polling places. That's just an example of the type of guidance that we've provided at a general level to the Secretary of State's office as they themselves are preparing.
Is that conversation, have you provided the recommendations that you're going to provide, or is that kind of an ongoing conversation as Election Day gets closer?
It's an ongoing conversation. As we learn more, as they pose additional questions to us, we try to get them the latest scientific evidence about ways to reduce transmission.
And then just kind of a follow-up question along the same lines. Is there any thought from the CDC or any kind of perspective about whether it would be better from a public health perspective for people to vote absentee versus in person?
You know, Evan, as with so many things related to the pandemic, there is not a one-size-fits-all answer for any one group, or certainly not any one person in Maine. The decision whether to vote in person versus whether to vote by mail depends on myriad factors. Your own individual health status, the background rate of COVID-19 in your community, and whether you are comfortable spending time at a polling place. Maine CDC's goal has been to, especially in connection with in-person voting, make recommendations so that in-person voting can be accomplished as safely as possible. But that doesn't mean that for every single person out there, that is the right option. If you've got questions about whether in-person voting versus voting by mail is the right thing for you to do, especially if you have chronic medical conditions or other health conditions that you believe might put you at risk, the best thing to do is to consult with your healthcare provider. We've got time now in the run-up to the election to get that advice from your own healthcare provider so you can get that really particularized advice so you know what's best for you.
Thank you.
I'm going to turn now to Patty White at Maine Public.
Thanks very much, Dr. Shah. I've got a question about the testing at Sanford High School. I spoke to someone who got tested, and they said they were told they would get the results in 72 hours, which would have been Monday, but they didn't get them. And I think they sort of heard the update from you today was kind of the first they heard about the results of that testing. Do you know when and how the results will be communicated to the people who were tested over the weekend?
Sure. The entity that we worked with to stand up the testing site at the high school itself, they are a healthcare company or a healthcare organization that we worked with in order to stand up the testing sites themselves. They conducted the swabbing and the sending of those swabs to the Maine CDC. Our laboratory ran those results, reported it back to this organization, and they in turn have the responsibility of returning results to everybody who arrived for testing.
Okay, great, thanks.
Mm-hmm.
And then I just wanted to ask about schools. I don't know if you saw the story in the New York Times about the Trump administration pressuring the US CDC to downplay the risks of reopening schools. I'd just love to get your take on the risks, and is it higher than we thought? And is it changing any of the thinking here in Maine about our strategy?
I am aware of that reporting. I did have a chance to read that story. let me just say right up at the top, to the extent that that reporting may have occurred, and none of that at all, not even for a split second, impacted or affected or altered the manner in which we approached the reopening of schools here in Maine. We stood by the science. We followed the scientific data on what we knew to be the potential risks, and we did not pay any heed to any of the things that were noted in that article, Patty. I just wanted to state that really emphatically at the top. None of that swirl affected anything that we did in Maine. Patty, the data around COVID-19 and school-age children are evolving rapidly. In fact, I literally have on my desk an article I just finished reading just a little while ago that was just published in JAMA Pediatrics, synthesizing a number of studies around the potential risk to children of getting COVID-19. And in general, what literally the latest data have suggested is that children can sort of be thought of in two groups, those essentially 12 and younger and those 12 and older. Those who are 12 and older have a risk of getting COVID-19 that is slightly more akin to what adults have. Those 12 and younger, thankfully, have a lower risk of getting COVID-19. And in all events, children seem to have lower, milder rates of symptomatic disease. That is the risk of COVID-19 to children. There's a simultaneous question of the risk of COVID-19 from children to, say, adults or others that they may come into contact with. There, the data are more in flux. There have been instances of transmission that have been documented where children have passed COVID-19 on to older individuals. But the frequency of those events and the magnitude of that transmission is not very well characterized at this time. That being said, Patty, we are thinking about the ways in which these latest data and this synthesis of the data, what that tells us about schools overall. One of the interesting findings from some of these data have been that overall, the number of outbreaks that have been detected in schools where transmission has occurred in the school itself has thankfully nationwide, not just in Maine, but nationwide, the number of such outbreaks where transmission has occurred in the school have been thankfully low. That they've not been zero. I'm going to be really clear. That does not mean that they've been zero, but they also have not been the norm, which was a fear that many of us had as we were going into the school reopening. The data have suggested those occurrences seem to be less common. That's encouraging, and it certainly helps us think about how we approach reopening. The questions here, there are still more questions than there are data. So as we continue to get more data from the scientific community, that will clearly help inform our process.
Thanks.
I'm going to turn next to Bob Evans at News Center.
Good afternoon, Dr. Shah.
Hey, Bob, good afternoon.
With the state doing so well with its availability for testing now, some people wonder why there is such a push for flu shots. They ask, wouldn't the new testing help tell the difference between if a person has COVID-19 or the flu?
Bob, I'm glad you raised that question. And the answer to your question is not exactly. It would not. But let's first start with the most important piece here, which is, has everyone watching gotten their flu shot? And if you haven't gotten your flu shot yet, have you made plans to get your flu shot? And if you haven't made plans to get your flu shot, I'm going to give it to you straight. What are you waiting for? Today is the day, if you have not made plans to get your flu shot, to make those plans. As soon as we're wrapped up here today, the one ask that I've got everybody is to look around the room in which you're watching this and sit down with everybody and make plans to go get your flu shot. Bob, to your question, the test for COVID-19 is distinct from the test for the flu. They're caused by different viruses from different families, and the test for one does not pick up the other. The reason that we're really urging everyone to get their flu shot is that we don't want to be in a position where individuals could potentially have symptoms that could be COVID or the flu. If we know that someone's had the flu shot, it makes the flu a less likely diagnosis, and it makes COVID that much potentially more of a likely diagnosis. So having had the flu shot helps doctors think about the potential risk that you might have COVID versus the flu. In addition, it also just helps everyone stay safe. And as we start bringing on more testing, not just for COVID, but doing more testing because we're getting into flu season, it helps, for having more people have the flu shot, helps us get a better sense of what the risk might be going forward for having the flu. So the tests are different, and the best thing that you can do right now, probably the best thing that you can do all winter to provide for your family's health, is to get the flu shot.
Okay, thank you. I have a follow-up.
Sure.
A viewer asked, with fall upon us now, do you know if there are any furnace filters or air system filters that people or businesses should use to help stop the spread of COVID-19?
So there are two elements to keeping buildings generally, to reduce the likelihood of COVID-19 generally spreading in buildings. One of them is ventilation, that is to say, opening windows, and the other is filtration. There are certain filters that can reduce the amount of virus that circulates. There are questions about the extent to which they are suitable for residences or even larger buildings. They go by various acronyms like MERV 13 and all sorts of things. I don't want to go into it now, Bob, because it goes down a lot of twists and turns. And if someone uses the wrong sort of filter, a filter that is too dense, they can end up burning their blower out. So I think the best thing to do is that if you've got questions around those things, there are various websites that are approved with good scientific information. The US CDC has some of those. There's also an organization called ASHRAE, ASHRAE, which is a society of engineers that focus on these things. Those websites have a lot of information about ways that you can go about these things. But the key here is not to rely on filtration. The experts that I've talked to have said that the key is ventilation, much more preferred than filtration. So please consult with an expert. Don't go out and buy a filter, because there are serious consequences of getting the wrong filter, from things like potentially blowing out your equipment or even things like carbon monoxide. So please consult with an expert before you make any changes to your house or your building's filtration system. I'm going to turn next to Spencer Roberts at WABI.
Thank you, Dr. Shah. There seems to be a lot of concern still about churches not following CDC guidelines. And I was just wondering, what authority does any state agency have over churches that don't follow the guidelines regarding the virus? If the CDC doesn't have direct authority the way it does seem to in some cases with businesses, is there any collaboration between other state agencies for enforcement?
Yes, Spencer, I'm glad you raised that. The answer to your question is yes. The most immediate authority for enforcement along that lines lies with the Attorney General and the Attorney General's office. The executive branch and DHHS and the Department of Public Safety and the governor's office have been working with the Attorney General's office in general as it relates to activities that we've received reports of in and around houses of worship in Maine. The Attorney General's office would be vested with more authority to investigate and follow up on complaints to the extent those complaints are in violation of Governor Mills's executive orders. We've had productive and collaborative conversations with the Attorney General's office, and they've been more engaged, and we're thankful for that, in helping us navigate and chart a course as we work with church officials, particularly after we've received reports of not being in compliance with Governor Mills's executive orders.
Thank you. And then really briefly, you mentioned that the CDC has guidelines in place for schools when they have, for example, one case of COVID, as has happened a few times here. Can you elaborate on those guidelines? We've seen some schools go entirely remote where others have sent maybe a grade home.
The ultimate decision as to where to go in things like moving to remote or moving to a certain class being home, the ultimate decision there does lie with school superintendents. Maine CDC and our colleagues here, as well as at the Department of Education, try to make sure we're providing the best available evidence, context around that evidence, and then any additional guidance that we feel is necessary as school officials are making their decisions. Where we get involved is in situations that may require testing, quarantine, isolation. But the decisions that you noted just a second ago, Spencer, around when to send a classroom home, when to dismiss school and move to hybrid or fully remote education, those are fundamentally within the purview of, say, the school superintendent. We work with them, and the guidance document that I outlined sets forth different scenarios. For example, when we're talking about an outbreak, the main question is who constitutes a close contact of an individual that may have been tested positive. Because in an outbreak situation, it is the close contacts who need to be at home in quarantine and who should absolutely be tested, even if they don't have symptoms. So we, for example, help the school characterize and investigate who those close contacts are so that the school can then work with them around testing and other things. We may help arrange that. We may provide guidance around who should be in quarantine, but a lot of the action really works and happens at the school level. I do want to take a second here to both recognize the immense amount of strain that this places on school officials, but simultaneously the truly wonderful partnership that we've had with school superintendents across the state. This is a brand new playbook for most everybody, certainly individuals who are school authorities. And I'm continually impressed and amazed by the way that they've internalized this and have been willing to work with Maine CDC and make these sometimes radical and bold decisions in order to keep kids in school safe. They have my undying respect.
Thank you.
Mm-hmm. And to round us out this afternoon, I'm going to turn to Patrick Whittle.
Thank you very much, Dr. Shah. The Bangor Daily News had a really good story earlier in the week regarding precautions taken by the 14 Maine county jails that showed that things like universal screening and mask use among staff was not so universal. I would love to know, the report was based mostly on August and early September. I would love to know if there have been steps taken to correct those things and if the jails are sort of learning from the example of what happened in York County yet.
Patrick, I would, for some more of the specifics there, I would probably refer you first and foremost to DOC. And then as it relates to the jails perspective, to the jails themselves, to be totally candid with you, they'd be able to provide more perspective around that. What I'll underscore though, is that Maine CDC has been involved in working with jails, and in particular, I'll just go back to talking about the very productive conference call that we had yesterday with members of the Maine Sheriff's Association and jail staff and employees. It was very clear to me, based on the questions and the requests for assistance that they made, that they are seeing where the direction is and what they need to be doing. I pledged on that call to make sure that my team at the CDC is always available to answer questions that they've got, whether it's a specific question around a client who's just come into their custody or a question around an employee who may have exhibited symptoms or been somewhere. We're always available at our 24-hour hotline to help. And it was really clear to me that they are wanting to go in that right direction to achieve full universal compliance.
The Sheriff's Association was, you mean?
It was, yes. The call was with the Maine Sheriff's Association and the members of the Sheriff's Association who joined us on that call yesterday, just based on their questions and their willingness to want to go the next step and peel back the onion, it was really clear to me that they are wanting to achieve universal compliance with all of DOC's recommendations and guidelines.
Including but not limited to at the jails?
Patrick, we spoke principally of the jails. That was the nature of their question. So I can't comment anything further than beyond that. That was the tenor of their questions. I'd probably turn you back to them to talk about beyond that, but their questions were focused on ensuring compliance within the jails.
Got it.
Mm-hmm. Great, thanks, Patrick. Well, I'd like to take a moment as we close to thank everybody for their time this afternoon. There's a lot going on still with COVID-19, and there still remain significant areas of concern. We'll have more to say about those later in the week, but what I wanted to note for everybody before we close is that although we've achieved great things in Maine with respect to COVID-19 and keeping a lid on things, there's still the possibility looming out there that things could reverse course. I not too long ago read a piece about the recent experience of one of our neighbors to the north, in this case, the Canadian province of Quebec, which has itself experienced a significant uptick in the number of COVID-19 cases. That piece was a cautionary tale, as much of what we've seen, not just to our colleagues in the north and elsewhere in the United States, but here in Maine can be. There are cautionary tales all around us. The job for us now is to make sure we are paying heed to those and learning the right lessons so that we in Maine can stay on the right course. So with that, everyone, thank you for your time this afternoon. As always, please be kind, take care of one another. We'll talk again on Thursday.